Schizophrenic healthcare doesn't work. You cannot have a doctor go into one room, use one EMR system that is perfected and designed to increase volume and billable procedures. Those two things in the same doctor, that's not compatible. There are two different philosophies of care. And so trying to do both at the same time is a recipe for failure. I find it very rare that a system would go to a health plan and say, I want to do risk or I want to do capitation. And the health plan says, no, thank you. I can't imagine that happening. Now, I can't imagine a situation where a health plan says, okay, tell me about your commitment to risk. Tell me about that. Because here's the problem. In the past, a health plan would say, I'll help you drive risk. I'll drive even more volume and more patients to your centers. But unfortunately, what a lot of these plans have seen in the past is, are you familiar with fake it till you make it? What these plans have seen is you fake it, you act like you do want to do value-based care, you consolidate all the patients, so you fake it until you have enough market power to raise prices and control volume, right? And that's what they've seen. So they said, tell me how much are you willing to invest in transforming your care model? And plans know this. And there's no true willingness to drive that. And so what ends up happening with these health plans is they go, yeah, I'm sorry, what you're going to do is I'm going to send you all our patients. You're really not going to transform your care model. And then when you have enough patients, you're just going to raise prices on me and tell me, too bad, who else are you going to go to? That, unfortunately, is what we're seeing.
Hey, Dr. Faisal Syed here. Did you like this video? Be sure to subscribe to our channel by clicking here. And you might like these other videos. Click up here to watch more.